Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape.
Hey there, Dr. Moya.
Hi, Brittany.
How are you today?
I am great as usual. Always excited about our podcast.
Wonderful. Me too. All right. So a good question to answer would be, how do you follow up with your patients that are traveling from out of town, like a good distance away, that aren't able to come to see us frequently?
That is a great topic to talk about. Obviously, I love to have my patients come back as often as we can get them to come back. It took me actually a while to get used to not seeing my patients post-surgery. I guess I'm a very hands-on kind of doctor. I guess you could say that. But over time, I got used to it, since we try to help as many patients as we can. And a lot of them may come from different states at this point. So we have a very, in my opinion, a good way in how we do follow up with our patients that are out of town. We offer phone follow-ups is usually our primary way, where I can talk to the patient, directly.
And how do you see them through the phone? Is it a video call?
So what I would do is I would have them send me photographs of the surgical site. I would have them send me photographs if there's any questions about any certain areas of the surgical site. And that would be done before the phone call. And then I would call them and we'd kind of go over everything.
Okay.
We have a very specific way when it comes to the timeline post-surgery, how we like to follow up with our patients. So usually, definitely, I want to talk to them within the week of surgery, and then usually 3 weeks from surgery, sometimes 6. Sometimes from there we go 3 months. And I definitely want to follow up with them in about a year to see how everything is going. Now, that would be a specific regimen that we would use. But obviously, if there's any issues, then we make up another timeline for that.
Right. And how do the patients send the photos? How do you use the systems?
We definitely don't have them just text it to my cell phone. That would not be HIPAA compliant. We don't want them to send it as an Instagram message either. That wouldn't be HIPAA compliant. HIPAA is obviously the privacy laws that we have to follow. Right. So we have a secure app, or it's like a texting platform that patients can use. And we send them a link for that. And once they get onto that app, they can actually send us anything they want, including the photographs, even videos sometimes, so that we can get a better picture of what's going on. But that's a secure, private way to do that. That is HIPAA compliant. And that to me is available at any point. So if I'm running around out of the office and somebody sends me something, boom, it goes right to my app on my phone.
Gotcha.
So it's readily available.
Right. And they can message questions there as well.
Absolutely. That app in and of itself, it goes directly to a general pool. But if I'm already selected as in something, we're communicating back and forth already, then it gets directly sent to me.
Okay. What about a timeline, like long term? Like, what if somebody wants to follow up with you a year and a half down the road?
No problem. We do the same thing. They can send us photographs, with the progress. We can set up a time for a phone call. Most of my phone calls are done on Friday afternoon. After the office's hours are over. We kind of shut the office down a little bit earlier, but maybe range anywhere from maybe like 3:30 to 5:30 or so. And that's usually when we follow up with patients. And of course, I do it at any point in time, meaning if a patient needs to reach me on the weekend, I'm always available, because it's either through that app, or if there's just something that's urgent or emergent, they can reach me through my business cell phone number, which we hand out, to every patient.
Right. Okay. Well, good. So there's always a way to get a hold of you or the office to follow up after a major
Absolutely.
surgery.
I mean, at the end of the day, if the office is closed because
Mm-hmm.
the regular business hours are over, I'm always available 24/7 to make sure that my patients are addressed. Things are addressed properly, and they feel that they have a way to reach me.
I feel at ease
Correct.
being home. Okay.
Absolutely.
Wonderful.
All right.
That was quick and easy.
Well, thank you.
Yep. Thank you.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the course of body lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.